Hi, I'm Lauri Kane from the Baltimore Plastic Surgery Office of Dr. Dean Kane. All right, a lot of women don't want to have to go through a face and neck lift, but there's a saying we say in our office is if you can pinch an inch, the minimally invasive procedures just aren't the right way to go. The only way to really take care of really skin laxity, neck laxity, is to really have to excise and remove the extra skin. So today I'm really going to describe the different levels of face and neck surgeries that Dr. Kane does. And you could do from simple procedures to more complex procedures. And so I want to, through the pictures you're going to see in this video, the range of types of face surgeries Dr. Kane performs. So the traditional face and neck lift, as you see in the first woman in this view, is where she actually had a full face and neck surgery. And what we mean by that is the excisions are going to be starting around the temple, going inside the ear, around the ear, and those incisions are going to remove the skin off the face and the skin off the neck. In addition to that, he does what's called the platysmoplasty. That's where you have an excision that's being put under the chin to bring the muscles of the neck together, and you get this really defined neck. So 6.5 years ago, I had my face and neck lift done, and you can see I have this really nice crisp neck because I too had the traditional face and neck lift. The scars are incredibly hidden, and you're not going to see anything. And that procedure is really perfect for that person who says, I hate my neck, but they also have a lot of skin laxity. People think, oh, I just want to get my neck done. You can't just do a neck lift alone if you have a lot of skin. You have to get rid of the skin off the neck because that extra skin has to also then go somewhere and it has to get off the face as well. So that first woman and myself had the traditional face and neck lift. And again, there's a confusion. We're just starting at the temples and going down. It doesn't include the brow or the upper part of the head. It just really starts from the temples, goes into the face and down the neck. Now, the next woman, who's an African-American woman, she actually had similar face and neck lift, but it didn't include the platysmoplasty. So in her case, when we did the full evaluation, we realized that just by doing the face excisions, not having to do the neck, when we pulled away her extra skin, her neck muscles were perfect. They didn't need to be done. Just by removing the extra skin off of her face was all she needed. So we do call that a face and neck lift. However, we're not including in that procedure the platysma muscle banding. That also, because she already had a very nice neck, we just had to get rid of her skin. Now, a lot of men think, oh, they're a little timid to do a face and neck lift, but you'll see the gentleman in this next view. He's still in the workforce. He still wants to look young and rejuvenated because of the fact that he's still working and he wanted to compete with his younger peer group. A face and neck lift in men, you can see how natural he looks. He's very youthful, very refreshed. He too had a fairly full neck. So he also then had the traditional face and neck lift, including the platysma muscle, in particular his case. Now, the next level down actually from all that is just doing a neck lift without removing skin. A lot of women in their 40s to early 50s, mid 50s kind of fall into this range. They're starting to recognize that they're really not happy with their jawline. They're not happy with the neck line. They don't really have a lot of extra skin, but they're really starting to see the fullness, a bottom heavy of their lower face. So we see a lot of 40 and 50-year-olds come for this procedure. This is where Dr. Kane just does an incision under the neck. He does, again, that platysmoplasty where you get that really nice, crisp neck. He does some little incision sites behind each ear where he actually lipocontours the jawline and lipocontours the neck, and then resuspends the neck muscles to give you that crisp neck. So the woman you see in this particular picture, she had a combination of things. She actually, if you look at her neck, we did this traditional, or not traditional, we did the platysmoplasty neck lift, lipocontoured with suspension technique. He then did threads in her face. So we were a little concerned that she might have some skin laxity, so we just added the thread lift procedure with that. That has become extremely popular in our practice, where we do the neck lift with thread lifting. That's perfect for that mild laxity situation. If you notice, her skin turned from this, a lot of pigment, sun damage, to beautiful skin. We put her on our Obagi ZO line, did a chemical peel all at the same time as this procedure, and then we did her upper eyelids. So she actually gave us 6 weeks before her wedding, and what you're seeing is what she looks like at her 6-week point, right after we did her surgery and she was ready for her wedding. We wouldn't recommend waiting that short a time, but we got it done for her. And so that is, again, the neck and the eyelids are really that 40, 50-year-old, starting to beginning to do some surgeries. The other thing I want to showcase is what we just recently had a facelift individual, a woman, do a face and traditional neck lift, and she was so excited about her results at 1 week and now at 2 weeks that I thought, okay, I've got to do a testimonial with her. And so what you'll see in this video is her 2 weeks post her surgery, and she is so thrilled, and she goes, I want to do a video, I want to be on your videos. I said, let's do it. And so now she's being showcased on our video today. And that's just 2 weeks after surgery. She looks amazing. She's thrilled to death. All right, if you really want to know more information, please give me a call. I'm happy to talk to anybody about facelift surgeries. Come and visit our drdeankane.com website for all our before and afters. And I've actually posted many of our patients' testimonials. Millie is one who shows how she looks at the 2, 4, 6 week mark after her facelifts. And I actually show mine too. So lots of blogs on our website letting you see how people recover from facelifts, which generally are 3 weeks. All right, I'm excited to share all this with you, and give us a call. Can't wait to see you, 410-602-3322.